New blood tests may soon be able to tell you how long a COVID-19 vaccine will protect you. Researchers are working to determine what level of antibodies is actually needed to fight off the virus. As Local 24 News reporter Jenny DePrizio explains, that information could help you determine if your current vaccine is working or if you will need a booster shot.
If you've had the vaccine, you may be wondering if your body created enough antibodies to protect you from COVID-19, whether it's someone who's immunocompromised like me or a healthy person. In the future, that could be a good piece of information to have.
It will be very helpful for us to know over time how much antibody level is needed to ward off infection or to make you immune or resistant to disease.
Dr. Stephen Threlkeld hopes COVID-19 research at the University of Oxford will soon help answer that question. Volunteers who've already had COVID-19 are allowing scientists to expose them to the virus for a second time to help determine how much antibody is needed to ward off infection. The volunteers in the study are all healthy young adults.
Though there's a little bit of controversy about doing purposeful infection to people, there's no question of what the value is to it.
In general, we are asking people not to get their antibody levels checked.
Dr. Alfred Kim with Washington University says while people often want to get tested for COVID-19 antibodies, for the majority of the population, for now, avoid it. If you're healthy, you should assume the vaccine worked on you. If your body didn't respond because you have a health condition or maybe on certain medications, Dr. Kim says at the moment, not much can be done about it.
If you don't mount good responses or you don't have a response, there's actually no mechanism in place right now to be able to mitigate that. There's no booster campaign, there's no booster strategy right now.
Dr. Kim also adds immune response is more than just antibodies.
So even though you don't have antibodies, you could still be protected because other aspects of the immune response have been generated. This is something, again, we're going to be looking at in the future.
From his research, Dr. Kim has discovered that people on certain medications, such as B-cell depleting therapies or glucocorticoids for inflammatory conditions, can have a reduced response to the vaccines. But Dr. Kim says checking for antibodies at the moment likely won't provide you with enough information when it comes to being protected from COVID-19. Dr. Threlkeld hopes with the research underway in England, soon that will change.
We need some context as to what that number really means.
Doctors say for now, until more information is available, try and resist getting an antibody test unless you're someone who has certain medical conditions and it's needed. Jenny DePrizio, Local 24 News.